Welcome back to Rohrich Knows podcast, helping you become a better and more informed you. AI is everywhere. AI is said to transform all of our lives, medicine, plastic surgery. So does it really do that? And can we trust AI over Google searches, over doctors? Well, let's find out. I found this very interesting study that actually, where parents looked at answers in pediatric population that were generated by AI versus doctors in ChatGPT, and see what the differences are and what the differences can be. And basically it was used to explore trust in AI-generated healthcare information, comparing it to real healthcare professionals. This was conducted by the University of Kansas, and it was published in the Journal of Pediatric Psychology. So I found it to be very interesting because the participants were presented with health information on topics like sleeping, training, and nutrition. And the texts were either AI generated, ChatGPT, or written by experts without disclosing the source. So what they found out and what they were looking for was trustworthiness, accuracy, and reliability. And really the likelihood of making use of them for healthcare decisions. Because right now, as you know, a lot of people just go to social media for healthcare information, which is probably not the right thing to do, or going to Google, because Google is not a doctor. He's wrong about 70, 80% of the time. So why would AI be better? I'll tell you why. So what they found was that many parents couldn't distinguish between AI and experts. But the distinctions were made that actually AI or ChatGPT, the content was often higher rated for trustworthiness and accuracy, believe it or not, because I think it goes a lot more into depth. And because AI is really an educable process, so if you ask it a question after it's given you the first answer, it makes it better. So I thought that was a little surprising. And then, misinformation. I think that obviously the potential for reliance on AI or healthcare information, if in general, can be, it can be done on either aspect based upon the amount of information that you received. So AI can actually influence decision making, and I think this study showed that in child's health. But it really needs to have professional oversight. At least it does today. And why do I say that? Because obviously AI is a tool that's in development, and it is certainly a powerful tool because it's a great aggregator of all knowledge. But it doesn't aggregate into knowledge specific for you. So that's still where you need people like me, a plastic surgeon or your physician, to say, okay, this is the body of knowledge. This is the information I've got about you, but this is how I'm going to apply it for you. So I think the big thing here is trust and consistency. And I find that the other search platforms for medical information can be very, very disparate. Google is, sure, it's very commonly done. It's available 24/7. But Google is not a doctor, and so you get a lot of mis or non-information or getting led down a wrong pathway. So AI has a distinction because they actually can learn from what you want. If you can say, okay, I want to get a rhinoplasty, okay, and they'll give you all the reasons for having a rhinoplasty, but then I want to find exactly how to do a rhinoplasty. I want to go to the top 3 rhinoplasty surgeons in the US, and they'll generate that from AI data. So much, much better and more interactive than Google can do. So I think that's very, very powerful. And of course, why do people and patients turn to AI over doctors? They're available 24/7. That's why they do Google. I mean, it's simple, it's easy to do, and it does encourage anonymity and privacy. That it definitely does. And then, and of course, it's instant, it's now. But the big thing about AI for healthcare is that it really has to be educated. You have to really give it enough information to make, a solid, knowledgeable response, kind of positive information in, positive information out, and then learning that, very, very powerful. So I think that's the drawback, but that's also the advantage, because you can start at a much higher level of education, because it'll aggregate all the information about, rhinoplasty or facelifts or headaches, and then you can hone it down to your specific needs and desires. So, but that's the key. So versus Google, you have to do a lot of ongoing searches. It's not going to get it better. But if you add AI to that, which really is powerful, then you can actually learn, teach AI to actually give you a better, improved result. Never take the first result as the end result, because it's got to learn what you are wanting it to do, but more importantly, based upon the specific information you're giving it, you can actually be very powerful. So education is very important. I think it's a great way to help patients prepare for questions and actually give them information about the procedure they're going to have, and it gives them a total anonymity on that, so they can ask it many, many different ways and many different times. So I think that's a good thing to do. I actually encourage that a lot. So, but remember, it has to be personalized. So you shouldn't, AI is not a vacuum. It needs to be interactive. It needs to be very powerful in how it's used, because it can be misused and lead to misinformation. So the big thing, I think, in conclusion with AI is that it's advice. And the best is advice with professional expertise. It's a tool for gathering information, and certainly that's very powerful for me. I can gather all the information I want that's not only in my brain, but also in the world, and then share that with the patient and make it very specific for you. So AI, used properly, is powerful. It's a very powerful device. So the takeaways are, if used properly, if educated properly, it's very powerful, and it can be very, very additive in your consult. So the key is it has to be taught to be better with education and questions from the provider and the patient. So I find this to be very, very useful. And if you have any questions or comments, give me your thoughts on ChatGPT and how you've used it in your medical care venues. I'm open to hearing that, and certainly helping you become more educated about AI and really the future of medicine, the future of healthcare, and how we can make it so much more streamlined and so much better using all the information that we have in the world. Till next time, stay informed and stay safe.